Welcome to the STS 2017. My name's Joel Dunning, and for this series of Women in Thoracic Surgery, I'm delighted to be with Betty Tong. Betty, you're an associate professor at Duke University Hospital, but we'd love to just talk to you about your journey getting towards that point where you're an absolutely fabulous job working with Tom D'Amico in a fantastic centre. But I think you had quite a long road to this, so just tell us how you started off, your first degree, and then where you started.
So I was an engineering undergraduate and actually started a graduate degree in engineering when I realized that medicine was really what I was interested in doing. So I came to Duke and had no intention of being a surgeon. I had lots of preconceived notions about surgeons being mean and not nice people. And when I started my first clinical rotation as a second year, I rotated on the general thoracic service by chance. Rotated with, at that time it was Tommy D'Amico and Dave Harpole. Had two really great weeks and enjoyed it and thought, wow, this is really fun. I really like this. But over the next year or two, as it came down to making decisions about career and training, I was really concerned about the length of time that it took to train as a cardiothoracic surgeon and wasn't sure that I was really up to it.
And when you were looking at the job of a thoracic surgeon as a woman and as a job, what were you feeling that sort of it was going to be like? Because it seemed quite daunting.
It was very daunting, and at that time there were no hours restrictions. There were very, very few women in cardiothoracic surgery, so essentially no role models. And at that time there was only one way to train, or one pathway to train, and that was to do a full general surgery residency, probably plus research time, and then 2 or 3 years of cardiothoracic training. So the thought of 9 years of very hard and difficult training was very intimidating to me at the time.
So what did you do after that?
So I actually ended up matching in otolaryngology, which is a shorter training track, and started my internship. At that time it was a full general surgery internship, and during my second year after internship really realized that I could do general surgery okay, and I survived and actually thrived in the environment. So at that point made the decision that I would return to general surgery training with the intent of being a thoracic surgeon.
So you were daunted by the prospect of doing thoracic surgery, went away, and then when you came back, I suppose all those worries were still there, were they? How was it when you then came back?
Well, when I came back, it was, during that general surgery internship, I had proven to myself that I could do it. And so it was less daunting at that point, and really it was a matter of getting through the general surgery training and getting into a good cardiothoracic training program.
Yeah. And was it difficult to actually get into a thoracic training program?
I was very fortunate. I matched at Duke, where I had been a student and where I really had wanted to go. I knew at the time that I matched in thoracic surgery, it was vasculobectomy was really gaining ground, and there were few centers that were really facile at doing the operation, and Duke was one of them. So I was really excited to be there.
Yeah. So if there are any women out there, which I'm sure there are, thinking about thoracic surgery, I mean, you had a lot of qualms, but what is it like to be a resident in thoracic surgery? I mean, what are the hours like? What's the night commitment, the weekend commitment?
Well, when I trained, I'm kind of sad to say that back in the days when I trained, it was before our 80-hour work rules. Now it's all residents are restricted to working no more than 80 hours, so there's a better work-life balance. The training is still hard. It's very intense. It's very demanding, and it's high stakes. But it's extremely rewarding too. And I think talking to any of our trainees who are relatively fresh out and have some perspective on it, it was worth it, and it was a good place to be.
And you've got 2 children now, a 3-year-old and a 6-year-old.
I do.
And how do you balance that sort of family and work now you're an attending?
It's a hard balance, the same way that work-life balance is during residency training. It's sometimes a matter of trying to keep your nose above water or all the balls in the air, but we have great support. I'm married to a surgeon as well. We have a fabulous nanny, and we structure our schedule such that we can we can be there as much as we can, and that the kids know that we're making an effort.
Great. Well, you've got there in the end, and now you've got an amazing job with Tom D'Amico. And I mean, what do you think in 10 years' time or 5 years' time? What do you think we need to do as a specialty to sort of make that track easier, or make it sort of less daunting for people like when you were at the start?
I think we've already started to some degree, having the multiple training pathways, having a 6-year training pathway and the 4-3 and the traditional pathway. I think that adds flexibility to people who, like me, maybe thought that they wanted to do thoracic from the outset. They would potentially go into an I6 or a 4-3. I also think that, like the UK has a parallel training program or some flexibility in terms of the trainees and the time that it takes to train, would be something to think about as a next step. Right now we're pretty rigid in our traditional program. It's 2 or 3 years following a general surgery residency. In our I6, it's 6 years. For people with families or people with illness, having some flexibility in the time that they take to train, having a milestone-based training program as opposed to a time-based training program might be the next thing to do, and I think we're getting there with the adoption of the milestones by the ACGME as well.
Great. Well, I suppose if there is anyone out there is a great Women in Thoracic Surgery organisation. It's very well organised. I'm sure you'd be happy to answer any questions from anyone.
Absolutely.
And they could get in contact. So,
Absolutely.
for myself, Joel Donning, and everyone at CTS Net, thank you very much for coming to talk to us.
Thank you, Joel. I'm delighted to be here.